Law that is set to go into effect later this summer is expected to help Missouri's healthcare professional shortage. Our Missouri Chief Capitol Bureau reporter Emily Manley explains why nurses pushed for this change. She is live in Jefferson City tonight. Emily?
Well, Mandy, under current state law, any advanced practice registered nurse is required to be in a collaborative practice agreement. What that really means is that a nurse practitioner, must have a physician nearby in order to do their job. Well, with some of these restrictions set to be lifted in just a few weeks, it's expected that patients here in Missouri will have access to better care.
Getting this done is really important work for our ability to continue to provide services in more isolated areas, primarily.
In a state that has a shortage of 600 primary care doctors.
Anybody who's called their primary care provider and they say we can get you in 3 weeks has felt that frustration of the lack of people in the healthcare system who can provide this type of care.
Missouri currently doesn't allow nurse practitioners to diagnose, prescribe medications, or evaluate patients without a doctor signing off. And that doctor must be within 75 miles.
We also have had some of the most restrictive policies relative to the geographic connection to the physician that manages an APRN.
Those restrictions are set to be lifted later this summer. Dave Dillon with the Missouri Hospital Association says this could be the answer to healthcare deserts in rural Missouri.
The nursing profession has advanced, but it's been absolutely necessary because there are too few doctors presently to handle the volume of patients.
Since 2014, 18 hospitals across the state have closed their doors, and all but one of the state's counties, Platte County, are in a health professional shortage.
While most of these changes won't affect a patient, they will affect the backside of healthcare.
Dillon says if you've been to an urgent care clinic, you've probably been seen by an advanced practice registered nurse. He says physicians have been opposed to the legislation in years past.
Because it's been viewed as an encroachment on that expertise. But I think physicians are starting to realize how important of a component these professionals are.
Now, about 40 states have already lifted these types of restrictions on nurse practitioners. This law that the governor signed last week is set to go into effect at the end of August. Reporting live tonight from Missouri State Capitol Bureau in Jefferson City, I'm Emily Manley, Fox 2 News.